My name is Dan Kelly, and I survived 4 overdoses. Been clean since July 21st of 2021. So I manage the distribution of our naloxone and the inventory of it, and do a lot of overdose or naloxone trainings, I should say. I would say it started before the drug use, really. The whole process of addiction started before that, and I was destined to become addicted to something just based on traumatic events, and being in a state of emotional pain that was unresolved since childhood, and something that really I couldn't resolve by myself. Well, there's been many stretches where I was using many times a day, every day, and I was pretty much staying high all the time. I would say just pills in general. I certainly liked the opioid painkiller pills, and then I later was introduced to heroin, and that was easier to come by. I was living in my parents' house at the time. I went out and got some drugs and overdosed, and they found me blue and called 911, and when the paramedics got there, they gave me naloxone and reversed the overdose and took me to the hospital. With opioids, they're a little bit different from other drugs in that they suppress your breathing, your respiratory rate, and so eventually, your blood oxygen level gets so low that you're almost dead, and it's just very easy to get there. So I was in a hotel room using, and I was actually using meth and a little bit of fentanyl and benzos, and I was just slowly wearing myself down to a point of where I felt like I was going to die soon from the drugs alone, and I also felt that my own actions and the dependence on these drugs had isolated me from everyone, and I was just so lonely that I got myself to like a personal emergency, or maybe a rock bottom as some people would call it, and decided to reach out to some people for help, and they were able to help me get to detox and then treatment.
I always like to first say that I'm a person living in long-term recovery, and what that means to me is I haven't used any alcohol or drugs or mood-altering substance since January 9th, 2005. So this year I celebrated 19 years of continuous recovery. And I think what a person like myself brings to the table is that we're in a community that a lot of people don't understand, or that are very stigmatized, right? Because we're drug users or former drug users, right? And that world looks different to different people. For me, it's pretty normal, like, to encounter people that are actively using or seeking recovery. And I think, though, when we do education or training, those of us that are in the recovery community, we bring that personal lived experience to the table, and it's really believable. I mean, when I do trainings, I interject my own personal story throughout the training of how this crisis has impacted me, or even being a formerly incarcerated person, things like that. Like, I think it makes it just more believable and more personable. Yeah, so I do all the public Narcan trainings. We're working under our second grant. The first grant we got, I think in 2018 or 19, was a Department of Health grant where we are allowed to provide these trainings to residents of Hennepin County, really anyone, and then we are able to give them the medication, or also called Narcan or naloxone free. And then we're now on another federal grant that we've been working under since 2022, where we're doing the same thing, where anyone and everyone really that wants to get trained gets trained. If you live in Hennepin County, you actually get a box of Narcan given to you or mailed to you or delivered to you, however we can get it to you. If you live outside of Hennepin County, I have a plethora of resources where I can make sure every person that attends a training has access to this medication. To me, it's no different than like people carry EpiPens or people carry emergency inhalers, right? I think that every person should be trained and have Narcan on them, because you never know where you're going to encounter someone that's overdosing. Literally, people use in bathrooms at gas stations, they use in parks, they use in places where all kinds of people show up. So everyone, literally everyone, should carry this medication and know how to use it.
I think it's just extremely dangerous, and we'd almost be in a much better place if we were to go back to it just being heroin. Like, it was bad then and dangerous then, but this is like a whole nother level that I would have never imagined we would be here.
Yeah, I would say in today's world with the overdose crisis, and now we're losing around 110,000 people a year, I don't think there's anyone that isn't impacted by this crisis anymore. I don't even know if you can find heroin anymore in Minnesota, at least. It's all fentanyl. I think the most dangerous thing we're seeing now with this crisis is the fentanyl is being laced into all drugs. So if you think you're using just cocaine, I guarantee you there's most likely fentanyl in that cocaine. If you're using methamphetamine, I guarantee there's fentanyl in that methamphetamine. The pills, people are exchanging pills with each other, and they think it's an Oxycontin or a Percocet, and I guarantee, unless that pill was from a pharmacy, that is not a Percocet or an Oxycontin. It is a fentanyl pill, and it could kill you.
Yeah, it makes me upset and angry, because I know that there's not really any safe way to be using these things. I mean, there's safer ways, but I don't feel like many people know what they are.
To me, if we don't get to the young people in this crisis, we're missing the boat, because we're losing a whole generation right now to this fentanyl stuff. The most dangerous thing I think a parent can say is not my kid, because I guarantee you it probably is your kid, but if maybe your kid's friend. Like, again, I don't think anyone is immune from this crisis. So talking about it, being open about it, eliminating the stigma around it, I think is key to success.